Hi, I'm Dr. Rodríguez-Feliz. I'm a board-certified plastic surgeon in Miami, Florida, and today I'm here with Elsa Rivero, our amazing nurse practitioner who leads our hair transplant team. We're going to be talking about a fantastic case of about 4,000 grafts for hair transplantation in a male patient. Check it out.
Hair loss can be caused by multiple factors such as stress, genetics, hormonal changes, medical conditions, and even some medications can cause them.
For this particular patient, we chose to do a hair transplantation to restore his hair loss because of his advanced aspect of the disease. So as you know, hair loss is a chronic condition, and in the beginning stages, you can start to see some thinning of some areas in the scalp, and a lot of the time those can be treated with less invasive treatments. But for this particular patient, he had a very advanced aspect of the condition, and when you have balding spots, a hair transplantation is the indicated procedure.
A hair transplant treatment plan varies from patient to patient depending the amount of hair loss, quantity, and quality of donor area. These factors can affect the outcome of the procedure.
So we're doing FUE technique right now. We're planting the hairs, the hair follicles. You see, we have harvested about 2,000 grafts. Recreated a nice hairline. Now we're increasing the density in the frontal scalp, working our way back. And this is all very delicate work, as you can see.
I really love the results in this patient, and I think the big part for this is that we had a mutual understanding in the consultation that we needed to do this in 2 procedures. I think that was very, very important, and I always tell patients, in particular when they have advanced hair loss like him, that it's very hard to accomplish this in just 1 stage. So for him, we designed a procedure that was totaling about 4,000 grafts, and we did an initial procedure where we used to restore and recreate his hairline and create some sort of structure to his frontal scalp. And a year after, we did a second procedure to increase the density. And that has been really the key aspect in having the result that we have. And that's why I feel he looks great, and I love really the results that we accomplished.
So how are you feeling now?
Amazing. Zero pain, no pain at all.
Good. And
She has amazing hands, so you don't feel anything.
awesome. So we're doing the FUE. So right now we're planting. And how was it when you were facing down while we were harvesting the hair? That's usually the worst
Yeah, because at the beginning you don't know exactly what's gonna happen, even though they explain. But once they start, it's like nothing. You just feel when they begin with the anesthesia, but that's all. Nothing else.
Better than what you were anticipating?
So much better.
That's awesome. All right, cool.
Tell me a few of the challenges that you've noticed with patients when they're coming in, for the consultation. Like, what's the biggest challenge when they come in?
I think the biggest challenge patients have is knowing when they need a hair transplant versus a hair loss treatments.
Yeah, I agree. I mean, that's the most common thing. A lot of the patients don't know if they're having just thinning or they're just having balding spots, and it's very hard for them to decide which kind of route to go. But the most common, which one would be, I would say, the most common patients that need a hair transplant in your experience?
So those patients that have more advanced stages and those that have balding areas, not necessarily thinning.
Okay, so I think that's one of the important aspects to understand, is that thinning can be treated a lot of the time with medical treatments or medical hair loss treatments, but actual balding spots are better candidates for hair transplants. And another important aspect is that patients feel that this is a cure for their disease, and it's important to mention that the hair transplant does not cure the chronic hair loss condition. So hair transplant will restore hair loss in the balding spots, but the patients actually have to do other things to try to control their hair loss. And a lot of these things are either oral supplements, topical supplements, injections such as PRP, exosomes, light therapy, And in reality, the hair transplant is saved for the more advanced stages where balding spots are needed to be restored.
And then in our consultations, we take a lot of time to educate the patients so they understand the difference.
Well, I hope this actually was helpful and answer some of the questions that you may have. And if you have any other further questions, please let us know. Thank you.